Autism is a neurodevelopmental condition. It is a condition which is characterized by difficulty in communication. And when we say communication, we don't mean just the spoken words. Communication goes beyond the spoken words. It is also characterized by difficulty in understanding emotions, in responding to emotions adequately, and the narrowness or the limited interest that an individual may have. So this is what autism is in the nutshell. You did say that how is it diagnosed? Autism is diagnosed by several methods. Some of them are simple clinical interview. That includes coming in contact with a specialist and explaining to them what the difficulties have been, how they started, and how they affect the patient. But there are some other tools, for example, a questionnaire that can be completed with a specialist, or a questionnaire that can be completed in advance to the appointment with a specialist. And finally, there are some observation tests where a patient is asked to do certain activities, a small test, and they're observed through those activities. And it is the observation along with the other information that helps a clinician to reach a diagnosis of autism. Yes, the answer to your question is yes, adults can be diagnosed with autism. We must bear in mind that autism is a neurodevelopmental condition, as I said, and it originates in childhood, but often the difficulties do not surface up until much later in life. It is not uncommon for me to meet somebody in the clinic and they tell me that they have been struggling with some of the difficulties and some of the issues in life in general ever since they were little. But it is either that it doesn't surface up, or the challenges of adulthood make them a bit more prominent, make those difficulties a bit more prominent, and therefore people seek help. Well, autism is, like I said, is diagnosed by multiple ways. A clinical interview is the simplest form of diagnosis, and it can take up to 90 minutes or maybe a bit longer, depending upon how forthcoming a person is with information. Then the questionnaires, they take a little bit longer, but the observation test, they take the longest, because sometimes we have to space the observation task out to make the patient a bit more comfortable when they are doing it. So altogether, it can take anywhere between 90 minutes to 120 minutes, so between an hour and a half to 2 hours. That's an interesting question, because ideally there shouldn't be a difference, but yes, there is. Mild autism, for example, is the one where the difficulties are not as prominent. So sometimes a specialist clinician may decide to do more than one test to be more confident, and therefore it can take a little bit longer. And the patient may find that they have a clinical interview and then a questionnaire and maybe an observation task all in one go or separately. Severe autism, as the name indicates, that it has the difficulties are more pronounced. So often clinical diagnosis is based on interview or general observation. So generally speaking, this more severe form of autism is more apparent and therefore less difficult or less time consuming to diagnose. Again, an interesting question. I think that often I say to patients and sometimes families too, that Getting a diagnosis is not an end point. This is not where the journey finishes. This is where the journey starts. Knowing about a condition, finding out that somebody has a diagnosis of autism, often the next step that we recommend is education about the diagnosis, understanding what it means, not just what the diagnosis means, but also what the diagnosis means for that person, not just for that person, but also for people who are around them, people who look after them or care for them. And finally, the diagnosis of autism is also about understanding about somebody's strengths and difficulties. So knowing what the strengths are and the ability to make them stronger for the individual, to maximize the potential in life. And then understanding what the difficulties are, so reasonable adjustments can be made around them to achieve, to help them achieve the potential that they can. I think this is what the next steps about diagnosis of autism should be.